Hello. I'm going to talk to you about breast self-examination today. And as you might be aware, there's a lot of controversy right now about screening mammography and breast exams. Controversy over when you should start doing screening mammograms, how often they should be performed, if they should be done in conjunction with a breast exam, and whether patients should do breast self-examination. This controversy is really related to statistical issues about the cost versus the benefit of mass screening, and I won't get into it too much, but I am going to make a pitch for the value of breast examination today. Breast examinations by a clinician and breast examination by a provider. And the basis for my recommendation is that a screening mammogram is intended to be performed on a patient who has no symptoms and no palpable abnormalities, nothing abnormal about their breast exam. And how are we ever to know if you have an abnormality on your breast exam if no one performs a breast exam? As a cancer doctor who actually performs physical examinations on my patients, I know that a thorough breast examination by a provider who does them regularly can detect cancers that elude mammography and even elude self-exam, because I have detected those cancers during the routine breast exam I offer my female patients. There are patients in this community who had their breast cancers diagnosed not by a mammogram but by my physical examination. I agree, however, that a quick pat down by someone who's uncomfortable with a breast exam is likely to be a waste of time. I'm also going to encourage all of you to start doing routine monthly or bi-monthly breast exams. Choose a day, preferably after your menstrual cycle if you still menstruate, and identify a comfortable place and a comfortable position for your breast exam. The idea is to cover the entire breast. So it doesn't matter if you use concentric circles, a spokes of the wheel approach, or if you do a 4-quadrant pat down. Just do it. Do it regularly and do it thoroughly. Why? For 2 reasons. First of all, if you start when you're young and when the likelihood of breast cancer is very low, you'll realize that you have some lumps in your breast exam and that doesn't necessarily mean you have cancer. So when you discover your first lump, if your risk of cancer is low because you're 20, you won't panic. These lumps may enlarge over time with your menstrual cycle and become tender. But if you ever discover a lump that consistently enlarges over several months, you should call that to the attention of your provider. The second reason to do regular breast self-examination is just as a horse learns its route home by following the same path day after day, your fingers will recognize something out of the ordinary if you regularly examine your breasts. My final comment is that a mammogram without an accompanying breast exam is an incomplete assessment. The screening mammogram is intended for someone who has no symptoms and no abnormal lumps. If you have a lump that is new for you, you are supposed to have an ultrasound as well as a mammogram. And if no one has performed a breast exam, how are you going to know that you have a lump that needs an ultrasound? Logical, right? So we'll talk more about how to do breast exams later. Thank you.